So, good evening, my dear MBBS first year students. This session is actually designed for you only. So, as we have seen that there is a trend of asking clinical cases of 10 marks, 15 marks in every MBBS first year professional examination. So, every Tuesday, I will be there for you. Every Tuesday, I will be taking one important topic in physiology, and also we will discuss in the form of clinical case. So how they can ask you clinical case and how you should write in the examination. So purpose is for MBBS first year student. So this is designed for MBBS Prof exam preparation. So let me take one example of a case which can be asked in your examination. A 21-year-old medical student reports falling asleep multiple times during lectures, and even while eating, he also describes sudden episode of knee buckling and muscle weakness during laughter. He once paralyzed while waking up, accompanied by vivid dream-like images. So vital and neuro examinations are normal. To be frank, that they are not having any neuro problem. Polysomnography, early onset REM sleep, multiple sleep latency test, two SOREMP come in the other form for MBBS. For example, a 22-year-old male medical student present to OPD with complaint of excessive daytime sleepiness. Do you know what is excessive daytime sleepiness? What is that called as? It is a clinical symptom of narcolepsy. So it is a clinical case which can be asked from your sleep problem. Okay. Poor concentration during the lectures and frequent dozing off during study hours. He reports staying awake till late night, browsing the phone, often feels tired despite sleeping for more than 8 hours. So his roommate report loud snoring, occasional sudden jerk in his limb during the sleep. So again, decrease REM sleep, increase latency, frequent arousal, alpha activity while awake. So this is showing you about narcolepsy. So they want to test that do you know exact concept of sleep physiology or not. So after that, they can ask you long question or Viva style question. They can ask, describe the different stages of sleep and their EEG pattern. Number two, they can ask you physiological changes in the REM sleep, or they can ask what regulates sleep wave cycle. If you remember in hypothalamus, there are nucleus called as suprachiasmatic nucleus. So they can ask you regarding suprachiasmatic nucleus, or else they can ask you explain the role of EEG in diagnosing sleep disorder or what is sleep apnea and how you can diagnose. So now we are going to discuss about the topic of sleep and EEG patterns. Okay, so EEG called as electroencephalogram. Electroencephalogram. One is ECG, electrocardiogram. It is EEG. Who discovered EEG? It is discovered by Hans Berger. So Hans Berger is called as father of EEG. It represents overall activity of the brain, and they are not action potential. They are summated potential, also called as local potential. They are summated potential, also called as local potential. So EEG, regarding EEG, they will ask you a clinical case, and then they can ask you about what is REM sleep, what is NREM sleep, what are the waves. So you must know what is EEG and what are the waves. So alpha waves or A wave. So alpha waves are the best wave. How to remember in the exam? Alpha are the best. Alpha, beta, gamma, like that. So alpha are the best when you're relaxed. See, suppose you are doing meditation. When you are doing meditation, it is the best thing that you are doing meditation, isn't it? So which wave will be there? Of course, alpha wave will be there. And the frequency of the alpha wave will be 8 to 13 hertz. It is, of course, low frequency alpha wave. And everyone want to be relaxed. So how can you relax? Either by decreasing the temperature or by decreasing the glucose, hypothermia and hypoglycemia. Why every study room has air condition, or you want to go to mountain to relax? Why every sage want to go to mountain? Because you want alpha waves. Alpha waves are the meditative wave when your eyes are closed and you are relaxed. So sometimes in the exam, they ask you Viva also, what are the condition which can increase alpha wave? Answer is hypothermia and hypoglycemia. And you can see the example of alpha wave frequency is 8 to 13 hertz. 8 to 13 hertz. Okay. Recently in the aims, they asked, what will happen if you open the eyes? Recently in this last week, the result. And this is from basic MBBS topic that alpha waves are prominent in parieto-occipital region, and when you open the eye, alpha will block. It is called as alpha block. So until your eyes are closed, okay, and your mind is relaxed, only then you can get wave called as alpha wave. I hope now you will not forget for your exam. In the MBBS, definitely they will ask you short note or long question or clinical based question about alpha waves. Alpha means meditative wave, low frequency. How can you increase? Hypothermia and hypoglycemia. Okay, so you are relaxed when your food intake is less and temperature is also less. And whenever you open your eyes, suddenly you start seeing something and alpha block will happen. So what is that called as alpha block? So first wave, doctor, is alpha wave. Next, beta wave. When you write beta, it becomes 13. So 13 to 30 hertz. At the end of the session, I will give you a mnemonic how to remember that. But before that, let me discuss the concept. After that, I will tell you in the exam how to remember the mnemonic. Okay. So when your eyes are open and you are listening to my lecture, you are attentive. Your eyes are open and you are attentive. Beta wave. So frequency is high. That was having 8 to 13. This is having 30 to 30. So frequency is better than alpha. But amplitude is less. You can see here. Amplitude become less. Frequency is high, but amplitude become less. And they are more in the frontal region because you are thinking the thought. So parieto frontal region. So beta wave, when you are attentive, your eyes are open and you are listening the conversation, or you are watching some movie, or you are watching some lecture, wave will be beta. Alpha, meditation. Beta, you are watching the lecture. You are attentive. Eyes are open, not closed. Third, theta wave. Theta waves are called as memory waves. Why they are called as memory waves? Because they are found in hippocampus. Do you remember in the exam they ask you what is the location in the CNS where short-term memory is converted into long-term memory? Short-term memory got converted to long-term memory in the hippocampus, and in the hippocampus we have theta wave. Theta wave are low frequency wave, only 4 to 7 hertz. They are also seen in NREM stage 1, and they are more common in the children. They are more common in the children. If you do EEG of children, of course, you will get a lot of theta wave. Theta wave. Otherwise, only when you start sleeping in an REM stage 1. An REM stage 1 is having lot of alpha wave and theta wave. Alpha wave and theta. So we discussed alpha wave, beta wave, theta wave. Next is your delta wave. D for delta, D for D. D for delta, D for deep sleep. NREM stage 3 or 4, deep coma, deep anesthesia, organic brain disease. You can see here, frequency is very, very low. Frequency is less than 4 hertz. Yes, hello, Yadav. Hello, Gadevpali. Everyone, hello, good evening, everyone. So, purpose here is to discuss those topics which will definitely come in your MBBS examination. First, Prof. This can come in the Viva, in your practical, in your theory class, anyway, but these topics are important. So I will be taking every Tuesday at the same time, 6 p.m. So I will try to cover before your examination a lot of topics which are important. Okay. So delta wave, D for delta, D for deep sleep. Deep sleep, deep coma, deep anesthesia, deeper disease, organic brain disease. So like that, you can remember for your exam, delta wave. Okay. Now, gamma wave. Some of you, suppose my lectures are watched by suppose 20 people or 200 people. Out of 200 students, I am taking a class in a lecture theater of 200 students. Out of 200 students, suppose 20 are having very focused attention. They are very focused. Okay. So if I do EEG, I will get which wave? Gamma wave. Gamma wave. So normally when you are attentive, you have beta wave. Normally whenever we are attentive, we have beta wave. But only when you have focused attention, you are very focused in the lecture or in a movie or whatever you are doing, you are very focused. You are doing calculus problem. Okay. So frequency is more than 60 hertz. It is called as gamma wave. Now everything can be remembered by a simple mnemonic called as gamma bad dance. Gamma bad dance. Now you will not forget. Okay. Let me add one page. So I will discuss everything with the help of this simple mnemonic called as gamma bad dance. See, gamma bad dance. Easy way to remember all EEG wave. Gamma frequency more than beta, more than alpha, more than theta, more than delta. Okay. So suppose you are in the beginning of a lecture and you are very focused attention. So which wave will be there? Gamma wave. So gamma waves are for focused attention. Gamma waves are for focused attention and frequency is highest. Gamma is the highest frequency. Suppose it is having 40, let me say 40, 50, whatever, up to suppose 70, 80 or 60 hertz. Okay. But you are having focused attention. Number two is your beta. Beta, when your eyes are open, of course, your eyes are open, you are in the class and you are attentive. I mean, you are listening to my lecture also, and your brain is going here and there also, what I will do after this session. So you are attentive, but not very focused. Which wave will be there? Beta wave. So which part is activated when you attend to frontal? So they are maximum in which area? Parieto frontal. So beta wave will be maximum in the frontal region, parieto frontal. And the frequency will be, if you let beta, it become 13 to 30 hertz. 13 hertz. 13 to 30 hertz. But suppose you are in the class and you start that closing your eyes. Now I will close my eyes and I will listen to lecture. So I will be very attentive. It is not like this. Because when you close your eyes, you become relaxed. Eyes are closed. You are relaxed. And thoughts are at your back of your mind. So parieto occipital. Initially it was parieto frontal. Now it is parieto occipital, isn't it? Easy way to remember. Easy way to remember. Parieto frontal beta, parieto occipital alpha. Eyes are closed, you are relaxed, and frequency become less 8 to 30. That now you are in the class, you have closed your eyes listening to my lecture. Suddenly you start sleeping. NREM stage 1. Which wave? Theta wave. Frequency will be less than 7 hertz, 4 to 7 hertz. And they are also called as which wave? Memory waves. Just now I have told you they are called as memory waves. Then delta. Delta means deep, deep sleep. Deep sleep. So NREM stage 3 and 4. Delta for deep. Delta for deep sleep. NREM stage and frequency will be least less than 4 hertz. So if you remember this page, mnemonic, I hope forever your MBBS, I mean, throughout your MBBS exam and up to your NEET PG exam, you are not going to forget about EEG wave, gamma bad dance. Now something about sleep. This come as a short note. This can come as a clinical case, as I have discussed in the beginning of class about narcolepsy. So they will ask you about the sleep. So normally we have 4 to 5 cycles of sleep, each of 90 to 110 minutes. So sleep duration is actually, it can be around 7 to 8 hours, whatever may be your duration. But this is having 4 to 5 cycles. And each cycle is of 90 to 110 minutes, having NREM and REM sleep. Now, NREM sleep is of around 60 to 70 minutes. REM sleep is of 15 minutes. NREM is non-rapid eye movement. You are relaxed. Your eyes are not moving. You are relaxed. It is the actual sleep. It is called as actual. You are actually sleeping. And REM sleep is actually what? Paradoxical sleep. You are not sleeping. Actually, you are sleeping, but your brain is not. I will discuss. Paradoxical sleep. It is rapid eye movement. Okay. So when we are sleeping, there are 4 to 5 cycles of 90 to 100 minutes. Out of this 90 to 100 minutes, 60 to 70 minutes of NREM, only 15 minutes is of REM. Normally, whenever you are sleeping, sleep starts with NREM, then REM, then NREM, then REM, like that. So it will start with NREM, then REM, then NREM, then REM. So like that, it will keep on alternating between NREM and REM. But as sleep continues, NREM keep on decreasing, REM keep on increasing. Okay. So as sleep continues, for example, you are waking up at 11 a.m. in the morning. Most of the sleep are what? REM. So you will feel tired because most of the sleep in the daytime is REM sleep. So even though you are sleeping for 8 hours, 10 hours, 12 hours, but you will feel tired. The reason is that you are waking late in the morning. So most of the sleep is REM. But very important, as I have discussed in the beginning of class about the clinical case, and that clinical case was about narcolepsy. And the characteristic of daytime sleepiness in narcolepsy is that sleep start directly from REM. So normally whenever we are sleeping, it is NREM, then REM, then NREM, then REM. NREM keep on decreasing, REM keeps on increasing. But in narcolepsy, okay, for the night you are surfing, you are seeing the reels and all. In the throughout the day in the lecture room, you are feeling tired, sleepy. Why? Okay. So during narcolepsy, sleep start directly from REM. Is it clear, doctor? So this is very important. As I have discussed now, let me discuss back in the question. In the beginning of class, I have given you the question. A 22-year-old male medical student present to OPD with complaint of excessive daytime sleepiness, poor concentration during lecture, frequent dozing. He reports staying awake till night. So a decreased REM sleep duration, increased sleep latency, frequent arousal during the sleep, alpha activity while awake. So this question is regarding narcolepsy. This question is regarding narcolepsy. When you will study in medicine, it will be discussed in more detail. It will be discussed in more detail in the medicine and psychiatry also. Lot of sleep disorders are there. But for physiology purpose, what they can ask you about the types of sleep, and at least you must know about narcolepsy. So normally, whenever we are sleeping, it is NREM, it is REM, NREM, REM. But in narcolepsy, it starts from REM. It's very, very important diagnostic tool to diagnose narcolepsy. Although a lot of things are there in medicine, only I will discuss for MBBS because this session is only designed for MBBS. So I'm not going to discuss that thing which is not for your important. Okay. So now NREM is called as deep sleep. NREM is called as actual sleep. It is a quiet sleep, orthodox sleep. It is good sleep. You relax in NREM. It is the best sleep. Non-rapid eye movement. It is the actual sleep. In NREM stage 1, stage 2, stage 3, and stage 4. How many stages are there in an REM, my dear doctor? See, to pass in your MBBS exam is very, very easy. Okay. Purpose should be you should pass in your MBBS exam, number one. Number two, your concept should be clear that when you go to your second year and you are studying pharma, patho, micro, then your basics should be very strong. And believe me, if you are in the right direction, right path, there is no way you get less mark in the examination. And for that, in this channel of Doctoral MBBS channel, I will come every Tuesday to at least discuss one very important topic that is important for your exam, for your Viva, and for your practicals. Okay. And believe me, a lot of questions you will get from these sessions. I will not waste much of your time, not more than half an hour or 45 minutes, but these sessions are going to be instrumental for your MBBS professional examination. Clear? So first stage, second, third, and fourth. First stage, as you close your eyes, आंखें बंद हो गई. Which wave? Alpha wave. Eyes are closed. Which wave? Alpha wave. Followed by which wave? Theta wave. I told you earlier also. NREM stage 1, which wave, doctor? Theta wave. Stage 2 are characterized by K complex and sleep spindle. Which wave is characteristic of NREM stage 2? K complex. See, K complex is like this. It is called as biphasic. It is called as biphasic K complex. And sleep spindle also. These are your sleep spindle. So as you are seeing sleep spindle and K complex, immediately you will say this is NREM stage 2. It is very, very characteristic. Stage 3 and stage 4 are mainly having deep sleep. They are deep sleep. So D for deep, D for delta. D for deep, D for deep sleep, and D for delta wave. Delta wave, deep sleep. Am I clear, doctor? Stage 1 and 2 are called as light sleep, and stage 3 and 4 are called as deep sleep. Which wave? Delta wave. Now, what are the changes? As asked in the question, what are the changes in NREM? So you are relaxed. So everything will be relaxed. Body movement will be less. Temperature will be less. When you are relaxed, when you're totally relaxed in your sleep, automatically temperature goes down. That is why immediately you wake up and increase the temperature of your air condition. You start feeling cold. Why at midnight you start feeling cold? Because temperature of your body start going down. Your BP will decrease. Why? You're relaxed. Your heart rate will decrease. Now, respiratory rate is the only thing that is going to decrease in both REM as well as NREM. I hope you will not forget this point. See, in NREM, BP will be less, temperature will be less, heart rate will be less, but respiratory rate is the only physiological parameter that is going to decrease in both REM and NREM. REM as well as NREM. So I hope now you will not forget. In REM, everything will increase. I will discuss later on. But respiratory rate is the only thing that is going to decrease in both REM and NREM. Because sleep suppresses respiratory center. Clear? Now, REM sleep, rapid eye movement. No, sleep, REM sleep नहीं है, धोखा है. It is a धोखा. Your brain is deceiving your body. आपके ब्रेन ने आपके बॉडी को धोखा दिया. How your brain is deceiving your body? Sleep नहीं है, धोखा है, because brain is active. And body is like, not paralyzed, I'm not saying. It is like paralyzed. I mean, muscle tone will be less. All the tone of muscle will be reduced as if you are paralyzed. Okay? So brain will decrease the tone of your body as if you are sleeping. But brain is active. Alpha wave, beta wave. Right now you all have beta wave. Even in REM sleep, you are having beta wave. Isn't it paradox? You will say, sir, I am watching your lecture and having beta wave. So why I will have beta wave in the sleep? That is why, doctor, we are saying it is a paradox. It is a paradox. That is why it is called as paradoxical sleep. आपका ब्रेन आपकी बॉडी को धोखा दे रहा है. बॉडी से बोल रहा है सो जाओ, प्लीज स्लीप, एंड ब्रेन इज गोइंग इन द पिकनिक. Brain is enjoying the picnic. Alpha wave, beta wave, as if it is awake. So muscle will get atonic except extraocular muscle and diaphragm. Because there is rapid eye movement. And why diaphragm? जिंदा भी तो रहना है. You have to survive also. Respiration is because of diaphragm. So you cannot decrease the tone of diaphragm. Diaphragm tone cannot be decreased, isn't it? So REM sleep. In the exam, if they ask you the characteristic of REM sleep, muscle tone will decrease in all the muscles except extraocular muscle and diaphragm. Now, they can ask you which is the first muscle to get atonic. Neck muscle. When you are going in a flight or in a train journey, suddenly you will get like that. When you're sleeping, you use a neck, this pillow. Why? Because you have neck atonia. So the first muscle to get atonic is usually neck muscle. And you know it is not a sleep. Your brain is deceiving your body. Okay. So BP will be high. Heart rate will be high. So BP, heart rate, they are going to be high. In males, there can be penile erection and sexual arousal in both male and female. So you can see here, if you see awake, when you are awake, EEG, we have alpha wave, we have beta wave. In stage 1, alpha wave and theta wave. NREM stage 2, we have biphasic K complex and sleep spindle. In stage 3 and stage 4, we have mainly D for delta wave. Delta wave is for deep sleep. And REM sleep, if you see EMG, it is for muscle. Muscle tone is 0. Muscle tone is very, very less. Okay, if you see EOG movement, rapid eye movement, in the REM, you can see rapid eye movement. Okay, so this is in genome. Just open your genome and see it is given there and recognize, try to recognize which wave is in REM, which wave is in REM stage 1, 2, 3, 4. So stage 1, alpha wave, theta wave. Stage 2, K complex, sleep spindle. Stage 3 and 4, D for delta, D for deep sleep. Okay. Now dreams कब आते हैं? REM or NREM? Both, but they are different. In REM sleep, REM dreams are very, very long, very visual, emotional, not connected to the reality. In REM sleep, you will see dreams which are not connected to your life. You will be king in the dream. You will be managing director of your medical college. But in the morning, you are a student. But by the time you are sleeping, you will become MD, chairperson of the college, or whatever. So those dreams which are not related to your life, you can be a king. Okay, तो उस तरीके के ड्रीम होते हैं ना, घोड़े पे बैठ के कोई आ रहा है, some 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 donkey sitting on the horse for you. All those dreams are what? REM. They are very long, they are very visual, they are very emotional, and they are fictional. They are not related to your life. But NREM dreams are short, less conceptual, less emotional, conceptual. They are conceptual because they will relate to your life and they are related to the reality. You are a medical student. In the dream, you can see you have exam and you forget the question. So those dreams are, and even you can have night terror. Night terror are usually not remembered. You will you will be fearful. And nightmare are in the REM. Nightmare. So nightmare, both you will get palpitation, you will get perspiration, you will be anxiety. When you wake up, you will be very fearful, frightful. But this nightmare is remembered. You will remember the dream. In the morning, you will call your friend and start talking कि कल मैंने सपना देखा, बड़ा डरावना सपना था. Okay, this was happening. You will remember. But night terror is not remembered. It is not remembered. ये याद नहीं रहता. Night terror, nightmare is remembered. कहते नहीं नाइट मेयर समझ के भूल जाओ, तो भूलोगे तब जब याद रहेगा. यू विल रिमेंबर इट. कैन यू रिमेंबर इट? यस. इन द मॉर्निंग you can recall the dream, but night terror is not. And you can also see a lot of thing in the NREM sleep, not the dream I'm telling, like sleep talking, sleep walking, bruxism. Some people are talking, walking, teeth grinding, bruxism. So these are mostly in NREM dream. These are mostly in NREM sleep, not dream, but sleep. Okay. So nightmare is in REM. Rest all sleep talking, sleepwalking, bruxism, they are mainly in NREM stage 2. Okay, stage mainly 2. So these are about. Now, can you answer some of the question? Which stage of sleep is associated with delta wave? Who can tell me the answer? D for delta, D for deep, stage 1, stage 2, stage 3, or REM sleep. Anyone of you want to answer the question? It's very easy now. D for delta, D for deep sleep. And deep sleep means which stage? NREM stage or REM stage? One, two, three, four. What do you think? Any one of you want to answer this question? Yes, deep sleep is delta. It is stage 3 and stage 4. So answer will be stage 3. Stage 1, let us revise, alpha wave and theta wave. Stage 2, what is stage 2? Stage 2 is K complex and sleep spindle. Stage 3 and stage 4 are having delta wave, and REM sleep, alpha and beta wave. Now, sleep spindles are characteristic of, stage 2, K complex and sleep spindle. Yes, you are correct, Doctorian. The biological clock regulating circadian rhythm, just now I told you, in hypothalamus, there is a nucleus called as suprachiasmatic nucleus. Okay, see, optic nerve, these are your beautiful eyes. These are optic nerve. This is optic chiasma. Above optic chiasma, we have a clock, and that clock is called as suprachiasmatic nucleus. This, along with the pineal gland, help you in sleeping, because when there is a darkness, okay, when there is night, pineal gland will release melatonin, hormone of darkness. It is called as hormone of darkness. That is why those who are going to, suppose US, if you are going to US and suppose flight is of 12 hours, suppose you started by 1 p.m. and after 12 hours again there is a 1 p.m., you will have a problem called as jet lag. You can have a problem called as jet lag. Okay. So this is suprachiasmatic nucleus. All of the following are features of REM sleep except dreaming. Muscle tone increase? No, it is decrease. Rapid eye movement? Yes. EEG resemble awake state? Yes. So muscle tone is not increased, it is decreased. So answer will be B. Nowadays in the MBBS, they will ask you clinical question. They will ask you physiological basis of clinical condition and MCQ. So now it is very, not very tough, but until you understand the concept, it is difficult to pass. That is why we have arranged this session every Tuesday. So purpose will be only to discuss the concept. Okay. Which wave is typically seen in the awake but relaxed state with the eyes closed? You know, you are awake, eyes are closed, and you are relaxed. Which wave? The best wave, alpha wave. Okay. So this is about MCQ. Now I have arranged, I hope you can see this. So 3rd June today, I have discussed sleep and EEG. 10th June, we will discuss ECG wave interval for your exam with the help of clinical condition, clinical case. 17th June, pyroreceptor and BP regulation. 24th June, hypothalamic function. 1st July, calcium metabolism. Then 8th July, hemoglobin and oxygen dissociation curve. 15th July, we will discuss GFR regulation. 22nd, neuromuscular junction, and 29th, cerebral function and lesion. So these topics we will discuss every Tuesday. And if you want your topic, which I should discuss, which you have got, you can just message me. I will try to cover that topic also. So this is it for today's class. See you next Tuesday for only MBBS professional exam. I hope this is clear. This topic is clear. Your time is crucial, so I will take class of 30 minutes or 35 minutes like that only. Okay. So thanks everyone. All the best. Thank you, Lucknow Media. Thank you, Ravi. Thank you, Ruturaj. Everyone, thanks a lot. All the best.